everyone, good evening and welcome to the Facebook Live with Global Hospitals Parel, Mumbai. Today we have an eminent personality with us who is master and the king of the field of medical science, Padma Shri Dr. Amit Maidev. Welcome to the show, sir.
Thank you.
Let me introduce, sir does not need an introduction, but yet I have to speak few things. Dr. Amit Maidev is the chairman at Baldota Institute of Digestive Science, that is BIDS, at Global Hospital Parel, Mumbai. His main research interest has been in the field of GI endoscopy, particularly interventional ERCP and the new specialty of third space endoscopy. He has done original work in the areas of endotherapy of chronic pancreatitis, GI bleeding, difficult CBD stones, and third space endoscopy. Padma Shri Dr. Maidev was the first to introduce POEM, STER, and ARMS procedures in India in 2012 and also initiated India's first bariatric endoscopy for weight management from 2018 onwards. Dr. Maidev received the prestigious Padma Shri Award for his outstanding contribution to the field of medicine and gastroenterology. He's also awarded as the Economic Times Inspiring Gastroenterologist of India in 2018. Dr. Maidev has also been an award winner in the first Cup of Endoscopy held in Chicago during the DDW. He has published over 300 papers in national and international peer-reviewed journals and has written chapters in 8 textbooks of GI endoscopy and related topics. Sir, we are so honored to have you on show with us. Welcome to the show.
Thank you.
Today, sir, we're going to talk about happy stomach. So when we say that we want to have a happy stomach, I can also think of many problems, generally that every normal person must have faced or must be facing some or the other time. So let me start with, sir, acidity. Sir, what is acidity? Can you tell us?
Well, Jyoti, actually, acidity is like a layman's terminology because every human being produces 1.5 liters of hydrochloric acid in their stomach in 24 hours. And that acid, every person has got acid production, but they don't have symptoms, what they call as acidity. Now, why is acid important? Hydrochloric acid in every human being is important to digest your food because whatever food we eat first goes and stays in the stomach for 3 to 4 hours. And in those 3 to 4 hours, the food gets pre-mixed and pre-digested because of the hydrochloric acid. And only after the pre-digestion with acid takes place, that food goes into the intestine for digestion, for further digestion and for absorption. Now, what happens is that in some people where the stomach lining is inflamed or because there is some infection or because there is inflammation of the lining, then what happens that acid causes burning in the tummy. Now that in a layman's language is called acidity. And another thing is food pipe cannot tolerate even 1 drop of acid because the food goes from the food pipe into the stomach and then it remains in the stomach, the food. And then the valve between the food pipe and stomach closes when that mixing of acid is going on with the food. Now, some people have got a loose valve, what we call as a hiatus hernia. And if they have a hiatus hernia, when this mixing is taking place, that acid comes up in the food pipe. And then they start getting burning below the chest, which they in layman's terminology is called heartburn. Acidity ho raha hai, acidity ho raha hai, chhati mein jalan kar rahi hai. That is acidity. Or some people, in their language, acidity means as soon as they eat food, they have sudden tightness of the tummy. They have sudden bloating of the tummy or constant discomfort, which they relate to acidity. So if you ask me from a layman's terminology, when they say acidity, it could be any of these things. It could be a lining inflammation of the stomach, or it could be a loose valve causing the acid to come up in the food pipe, causing heartburn, or what we call GERD, reflux of acid. And these are the main things. But this is what I mean. What is what you mean by acidity, Jyoti?
Okay. Now this is really knowledge for us, doctor. because we really never knew that the term what we use acidity has so many details in it. So, Doc, how can we keep ourselves away from acidity or, have a happiness without acidity?
You know something, the most important thing is food. And if we decide and if we in our mind take precaution as to how much food we eat or what we eat and when we eat and what is the time interval between two meals, then in most of the times you can take care of your acidity or make sure that acidity never happens. Because the commonest problem in today's world is people are running after work, they are running after so many things, but they do not have time to actually concentrate on what they are eating and how they are eating, or the gap between the two meals. So what happens, either they eat too much in a hurry, or they eat only too long with a too long gap, that we eat in the morning then suddenly eat in the evening. Till that time they are so hungry that when they come home they completely fill up their tummy. So what happens is when you fill up your tummy too much, then as that acid is getting mixed with the food, that acid starts getting splashed up in your food pipe. And second issue is uncooked food or food which is sometimes contaminated with bacteria. Because one of the commonest reasons of acidity is H. pylori infection. And suppose you eat outside food, or you drink impure water or food that is not cooked properly, then such type of H. pylori bacteria enter the stomach, and those bacteria go and stay in the lining of the stomach and cause a subclinical inflammation of the lining, which is called gastritis. And then the patient starts experiencing burning in the tummy, or tightness in the tummy after eating food, or sudden bloating. These are the symptoms of gastritis. And of course, because of a very hectic lifestyle, if the mind is not quiet, if there's too much of thinking going on, worrying going on, then this valve also starts becoming loose. Or if your food is too fatty. So in very simple language, I want to tell you, if you want to really prevent acidity, and prevent going to a doctor, number one, you should eat lesser than your capacity. Never eat until you feel full. Second is eat at frequent intervals. Every 3 to 4 hours, your stomach empties. Don't remain starving. After 3 to 4 hours, take a small meal, eat something. Ideally is fruits, because most of the fruits are alkaline in nature, except for some citrus fruits. So if you keep on eating fruits in between, every 3 hours, 4 hours, either a meal or a fruit, then what happens is the acid that is all the time getting produced in a stomach keeps on getting neutralized. And if you're careful that you're not eating impure food or uncooked food and drink pure water always, you will not even get the H. pylori bacteria. So the secret is small meals, frequent meals, and eating slowly. You have to allow your teeth to do their function of grinding the food. In today's world, we do not have time to eat. We are gulping our food. And when we gulp our food, that one step of digestion, that is grinding, which is done by the teeth, is lost. And then that work has to be done by the stomach. So these simple things I have told you, which can be done at home. And if you take these simple precautions, you will not need a single medicine. You will not have to go to any doctor for treatment of acidity.
Oh, that was a lovely one, Doc. Thank you. So my next question to you is another common ailment of stomach that we always talk about is constipation. So, Doc, what is constipation? How is it caused? Can you tell us?
See, constipation is also a very complex issue, because in every person who comes and tells me that they have got constipation, their way of description of constipation is different. And then what we do is we first listen to the patient carefully. What are they telling us? What is their description of their constipation? And then accordingly, it's like solving a puzzle. Then we realize what is the type of advice to give that patient. I'll tell you simple things. Various aspects of constipation. For some people, they don't get the urge only to pass a stool. That is one type of constipation. Other people, they get an urge, they go and sit on the commode, they try to pass stools, but the stool is so hard that they have to keep on pressing, it doesn't come out. In third category, they keep on passing frequently. That means every 3 hours, 4 hours, 3-4 times in a day, you get an urge to pass stools, but not a single time they feel satisfaction that they have cleared their bowel. But the stool is not hard. And another type of constipation is where you eat something and immediately you feel like passing a stool, but that stool is not clear. So there are 3 or 4 different types where the patient describes that they have got constipation, or you can say that they are not clearing their bowel. So I'll tell you what, in older age group, commonest thing that happens is they don't get the urge only. Why? Number 1, it could be because of age. Number 2 could be because of reduced amount of food intake as the age increases, amount of roughage they are eating. Number 3, if the patient is highly diabetic or something, then what happens is the colonic, the large intestinal movement only reduces, and then they don't get the urge. That is called bowel inertia. Now these patients are treated in a different way. Now those patients who keep on getting the urge constantly but are not clearing or having a satisfactory motion, this is typical of irritable bowel syndrome, constipatory variety. This is not true constipation. This is a IBS. And in these patients, we have to only rectify the type of food that they eat, the diet that they eat. We give them more fiber to eat in their diet. So the type of medications we give is also quite different. And if the stools are very hard, then we have to give, they get the urge, but the stool is hard. Then we give them medicines which are lubricants, which are stool softeners, instead of giving stimulants. So instead of giving a stimulation type of a laxative, we give them lubricant laxatives. But if you don't get an urge to pass a stool, we give them stimulation laxatives. So, this is how we dissect out the symptoms of constipation, understand exactly how the patient is eating, what type of food, and then give them the proper advice.
I am so amazed that there are seriously so many types of constipation, whereas we only hear a word constipation. Thank you, doctor. Thanks for enlightening us.
Because it is a very, very common element in today's scenario. And this constipation and acidity are the 2 most common elements which we see in our GI OPD.
Oh, okay. So, doc, are there any stages in constipation? Like, can constipation lead to any other ailments, a bigger or a serious ones?
No, constipation does not lead to any ailment, but a serious ailment can present as constipation. For example, if a patient has got constipation from recent onset, that means for many years, that person has been passing stools normally. And now suddenly, since last 3 months, they have noticed that they can't pass, or they are having a very lot of difficulty in passing stool. This could indicate a major alarm problem. It could indicate a cancer. So if the constipation is of recent onset, it needs to be investigated. But if a person comes to me and says that I have got constipation for last 30 years, but last 3-4 months it has got little aggravated, then I'm not worried in my mind. I know that this could be because of some minor issues which can be rectified. However, many times when the patient comes to us with constipation, we do subject them to a procedure called colonoscopy, where we look inside their large intestine with an endoscope and we get an idea as to what is going on. But before doing the endoscopy, we take a proper history. What is the type of constipation the patient has? What is the dietary pattern? And then we make a conclusion as to how to treat.
So this is an organized way of getting it done. Doc, but nowadays, if you see, there are many people, like you have a family physician, they have a family, medical store. So they always tend to go and buy, over-the-counter laxatives, feeling constipated, buying laxatives. What would you advise them, doc?
But that is exactly the reason I told you. The laxatives are of various varieties. You have bulk laxatives, which are basically fiber, where patient is not forming well-formed stools. Those are the people you give bulk laxatives like Isabgol, for example. Or patient who is not getting urge, you have to give stimulation type of laxatives, which are stimulating your colon. Or if your stools are hard, then you give lubricants or you give stool softeners. But that patient doesn't know. Patient just goes to the chemist and takes some laxative. So it is very unlikely just by taking some random laxative, your constipation will get relieved. As I told you, this has to be sorted out like a puzzle. And only if you go to the right person and get it sorted out, then you can get the right medicine and the right advice. But just taking off-the-counter medicines, I don't think is the right approach.
Doc, earlier in the conversation, you mentioned about gastritis. So when the stage of gastritis or this ailment is there, is hospitalization required? Because we've heard a couple of people telling that they got admitted because of gastritis. So how serious is this issue?
No, gastritis per se is not a serious issue, because if you ask me personally, if you take 10 people walking on the road, at least 6 or 7 will have gastritis. They will have symptoms of acidity or gastritis. But very rarely, if you have taken some severe painkillers, very strong painkiller medications, especially in older age group, then it can be a hemorrhagic gastritis. That means these can cause not just swelling of the lining of the stomach, but it can actually cause ulcers, and those ulcers can bleed, and those ulcers can sometimes rupture. So these type of severe gastritis patients only require admission. But otherwise, most of the gastritis patients can be treated by simple alteration of diet, taking proper precautions and simple medications to cool down the lining of the stomach or to suppress the acid production.
I am getting a viewer is asking a question, doc, that he is generally bloated after having his dinner. So, what can be the reason and what precautions should he take?
See, bloating is also a very important symptom. But I just want to tell all our viewers that we have to remember that our intestinal tract is not a gas producing factory. 90% of the air which is found in the intestinal tract is swallowed air. Commonest reasons for bloating is eating too fast. If you eat too fast, every time we gulp food, we are swallowing air, and that is the time that causes bloating. Second cause of severe bloating is long hours of starvation. What happens is, too long you have starved, and then suddenly you come home, you are very hungry and you start eating a lot. That can cause also bloating. Okay, so these are the two main causes of bloating. Third, of course, there can be other causes also. If the bacterial flora in your intestinal tract, their balance changes, then you will have gases or bloating. Now, this symptom, what you told me, this patient is asking that after having dinner, they're having bloating. I think it's important that that person should have an evening snack also, not be too hungry when you are having your dinner. And whenever you are having your dinner, the dinner, as a rule, should be the lightest meal of the day. And if you keep your dinner as the lightest meal of the day, and that to eat slowly, then that bloating will go away, and then you have a very good sleep in the night.
Okay, thank you, doctor. Doctor, coming now that the monsoon has set in, what are the precautions we should be taking during the monsoon so that we are away from the stomach ailments?
See, monsoon, the commonest problem which we have in the GI tract, gastroenterology, is infections, mainly because of contamination. See, in monsoon, what happens is sometimes the food, because of the overall increased moisture in the air, even the food gets spoiled faster, especially if it is kept outside for a long time, or stored food if you eat. If you feed outside food on a stall, on a roadside stall, for example, very likely the food is likely to be contaminated. In addition to that, the water, you have to be extra careful that you drink purified water. Make sure that your water gets purified, because even though we have got excellent systems of water supply, sometimes these water pipes get contaminated with the drainage system. And then the water which comes to your house can be contaminated water, especially in monsoon, because the drainage systems are usually overloaded or full because of the rain and because of flooding. So you have to be very careful that in the monsoon, you have to drink specially purified water, and make sure that you don't eat outside food which is uncooked. If you do that, the chances of getting infection in monsoon are much higher than in other months in our country, especially. So this is what I want to tell you, that in monsoon, this is what you have to take special precaution to prevent GI infections. Otherwise, it can cause loose motions, gastroenteritis, and then later on, the same gastroenteritis sets in as post-infective irritable bowel syndrome, or IBS.
Okay. Doc, can you tell us a little more about IBS? Because this is one common term which is now used like a corporate word in the corporate world, that, oh, I'm suffering from IBS. What do? I do some dietary changes. I feel relief for some time. But again, I'm getting the same issue. So, Doc, can you throw a bit more light on this?
You know, IBS is not actually a disease. IBS is a symptom complex. Because in IBS, most of the time there's nothing organically wrong. So whenever we label a patient as IBS, number one, IBS diagnosis is a diagnosis of exclusion. So we have to first investigate the patient to make sure that there is no organic disease, and then we label that patient as IBS. And IBS is of 3 different varieties. Number one, or 4 different varieties. It can be painful IBS. That is intermittently you keep on getting abdominal spasms, intestinal spasms, just pain. That can be painful IBS. Second is gas bloat type of IBS. You keep on getting these gases all the time. All the time all the gas is building up, tummy bloats up. You keep on passing flatus from below. So this is what happens. Gas bloat type of IBS. Then you have constipatory type of IBS, I mentioned to you. You keep on going to the loo again and again, keep on trying to pass motion, but at no given time your motion is satisfactory. And fourth is a diarrhea type of IBS. You keep on getting semi-liquid stools, semi-solid stools. They're not actually liquid, but semi-solid stools. Now this is also IBS. One of the commonest reasons of IBS is unquiet mind. And that is the reason why in executives, why in the corporate world, IBS has become famous. Because these are the people who are constantly thinking, they are achieving goals, they are running from pillar to post, and because of which they don't have time to concentrate on their own self, they don't have time to concentrate on their food. And that is the reason these are the people, mind and gut is directly related. If your mind is thinking too much, your gut is acting too much. Your gut starts moving much more than normal. And then all the time you feel like going to the loo. All the time you feel like going to the loo, going to pass a motion, but nothing comes out. Only little gas passes out or little stool comes out. This is classic IBS. Or you keep on getting these spasms in the abdomen. So for IBS patients, now what we do is, number one, we ask them to take their food very seriously, keep some time for themselves, and number two, use various techniques to keep your mind calm. Try to flow with the tide. Don't get affected by your surroundings. Don't get affected by people, or don't get affected by your work. So keep on flowing with the tide. Try to keep as calm as possible. Use meditation techniques, pranayam techniques, yoga. These are the things which we try to advise them. Along with simple medications like digestive enzymes, or we give them some probiotics. They don't require any major therapy. Sometimes we have to give them antispasmodics if they have spasmodic type of pain in the tummy. So this is how we tackle patients of IBS.
Thank you for telling us about this corporate disease. So my next question too is that we also hear about ulcers. Like mouth ulcers, people are more aware of, but there is stomach ulcers also.
Oh yes, of course. I told you gastritis. See, gastritis can cause stomach ulcers. Now, stomach ulcers can be caused either because of unnecessary too much intake of painkillers. See, because there are some people, especially in the older age group, suppose they have got knee pain, body pain, low back pain, they keep on popping painkillers. Now, these painkillers have got a very bad effect on the stomach lining. They can directly damage the lining of the stomach, create an ulcer. Or H. pylori, I told you, H. pylori infection because of impure water and food, that can cause a duodenal ulcer. That is the beginning of the small intestine. So nowadays, H. pylori is known to cause this duodenal ulcer. Duodenal ulcer, previously it was thought that it was because of acid production. It is not because of acid production, it is because of infection. So by treating H. pylori, these ulcers heal. And third, you can get ulcers in the large intestine also. And large intestinal ulcers also can be because of infections which are going in through the food, which is called infective colitis, or you can have some immune system related diseases, which are 21st century illnesses, what we call as ulcerative colitis, where if you do a colonoscopy on these patients, we'll find carpet of ulcers in the large intestine. So this illness is called ulcerative colitis. So ulcers can occur anywhere from the mouth. Usually mouth ulcers occur if your digestion is not proper, if you have got some vitamin deficiencies. Esophageal ulcers occur if the acid is coming up in your esophagus or food pipe. Stomach ulcers occur if you are taken painkillers or if there is H. pylori. Duodenal ulcer occurs because of H. pylori. And colonic ulcers occur either because of immune system diseases like ulcerative colitis or again because of infection. And small intestinal ulcers can also occur in those old people who are given certain medications for heart. Suppose they have a heart ailment, they are taking medications. Those medications sometimes can cause even intestinal ulcers, which can bleed. So these are the various types of ulcers which can happen inside. And what is ulcer? Ulcer is a wound, jakham. If you get an ulcer on the skin, how it is a jakham? If you get a wound in the inside of the lining, that is called ulcer.
Okay. Now, these things are, I mean, so many things that we are learning from you today, doctor, because this ulcer is just a word that has been used, but today you told us about ulcers which can occur at different stages and different parts of your stomach itself. So,
Yes.
doc, what is the treatment generally that has been done for an ulcer patient who comes to you?
Ulcer patient, it depends upon where the ulcer is located. So once we make a diagnosis, see, suppose the patient has a stomach ulcer, then we give certain medicines to improve the lining of the stomach. We give certain medicines to take care of the infection of H. pylori. And we also give medicines to reduce the acid production. See, because once an ulcer forms, we have to reduce the acid production. If you pour acid on a wound, what will happen? It will burn you, right? Same thing happens. If there is gastritis or if there is ulcer, acid is already there in your stomach. So you are bound to have burning. So if you don't suppress your acid until that ulcer heals, your burning will continue. Or suppose you have a ulcerative colitis, if you have ulcers in the colon because of ulcerative colitis, then we give different type of medications, and those medications heal those ulcers. So ulcerative colitis, for example, I'll tell you, is a different type of disease. It is like a civil war going on inside the body, where your own body is fighting against your own body cells. Your own body cells feel that your colon is somebody else's. So your own cells are fighting and attacking your colonic lining. So we give medicines in such a way by which your body cells are also kept quiet and your colonic lining is also kept quiet. So we are trying to solve this war, civil war, which is going on. So depending upon the type of ulcer, the cause of the ulcer and the location of the ulcer, we give treatment accordingly.
Okay. Doc, my next question is not a common thing that is found in most of the patients, but Doc, what is a stomach cancer? So this is also a term that has just come up from a viewer who's asking me, what is a stomach cancer? Cancer.
Cancer?
Yeah, stomach cancer, he's telling. What is a stomach cancer?
See, stomach cancer is again depends upon which organ is there, right? In your GI tract. You can have a cancer of the food pipe. Cancer of the food pipe, if you get, then the symptom which you will have is difficulty in swallowing. So I just want to tell all my viewers that anytime if anybody has difficulty in swallowing, it is an alarm symptom. You should never neglect a symptom of difficulty in swallowing. Immediately go to your doctor and get yourself checked up. Or second, if you keep on having a loss of appetite over the last few months, or after eating little bit food also you are feeling full. Initially you could eat everything, but now even after a small meal you started feeling full. Early satiety, or if you start losing weight, just like that, and you're eating normal food but you're losing weight, this could indicate a stomach cancer. You should have a look. You should try to investigate and find out whether there is a cancer. For example, if you have a cancer in the large intestine or colon, the symptom will be bleeding from the rectum. So again, a big message to the viewers. If anytime you are bleeding from the rectum, don't think that this is just piles. Always get yourself checked up. Bleeding from the rectum can be because of a checked up. Okay. Similarly, you can have a cancer of the liver. You can have a cancer of the pancreas. Cancer of the liver or pancreas can cause jaundice, which is called obstructive jaundice. So stomach cancer is a very loose term. Cancers in the gastrointestinal tract can occur in various organs. But there is one organ in the GI tract which usually doesn't develop cancer, and that is small intestine. Small intestine is 21 feet long, but usually we don't see cancers of the small intestine. We see cancers of the food pipe, cancers of the stomach, cancers of the large intestine, of the liver, of the bile duct, of the pancreas, but we don't see of the small intestine. Very rare.
Okay. So, Doc, right now you have guided us with most of the common ailments that we are facing, and that was really very helpful for us. So we can ensure that we have a happy stomach that we started with our show. So, Doc, before we end the show, what is your message to all of us who's listening to you and who are fortunate to have you today here?
Well, message I want to give is that to keep our body going and for living, there are two things which are important. Number one is the air that you breathe, and number two is the food that you eat. Air that you breathe is not in your control, that's happening automatically. But the food that you eat is in your control. So if you look after the food that you eat, the amount of food, the timing of food, the type of food, and the way you eat food, then you can keep your stomach happy. I think everything ultimately relates to this food, because we keep on eating without thinking, or we don't bother at all what we are doing. So take care of your GI tract yourself, and then you will not need to go to a GI doctor.
Okay, Doc, thank you so much for being there and giving us your treasured time. We really had a good time talking to you. It was very
Thank
educative.
you.
Today, we know what is acidity, we know the types of acidity, we know the types of constipation. I myself feel so enlightened and educated. Thank you so much for
Thank
being
you.
there. I also thank
Thank
all the
you.
viewers for being with us today. And thank you so much, Doc, for being with us. Thank you.
Thank you. Thank you. Thank you. Bye.
Bye.